Welcome to the Breast Cancer Network Australia interview, Understanding Genetic Testing for GPs. My name is Megan Walker, your host. I'm joined by Dr. Michael Gaddis, who is a clinical geneticist with Brisbane Genetics. Hello, Michael, and welcome.
Hello, Megan.
Michael, thanks very much for joining us. This is the third interview we're doing in a short series. The first two have been for patients, understanding genetic testing, and the second one, family considerations. And this is the third video that we're doing dedicated for GPs who might be new to this space, or a refresher never hurts. So we might just kick off with covering what is genetic testing. Thanks, Michael.
It really is molecular diagnostic testing to, in my context, look for germline mutations or inherited abnormalities in genes that put you at high risk of developing cancer. But of course, genetic testing also encompasses things like gene testing in cancer cells, and that's somatic gene testing. And I really won't be talking about that any further today. But an example, for example, in breast cancer includes the amplification for HER2 genes. So if a woman has HER2 positive breast cancer, that actually is an amplification of a proto-oncogene. It's a gene test in the cancer cells, but it's not an inherited abnormality. So my focus really is on inherited abnormalities, is the base on which I work in.
Okay. And speaking of inherited, Michael, are all genetic mutations or faults passed on to children and grandchildren?
In cancer, no. Most are acquired. Most are not due to an inherited gene defect. And fortunately, if you've got a family history of breast cancer, it's loosely defined 3 or more relatives on the same side of the family. No more than about 20% of those families turn up an abnormality in BRCA1 or BRCA2. We now can include some of the other less common genes, for example, and the cost of testing is now about $400. So I test 30 genes for that amount of money, but it's possible just to get BRCA1 and BRCA2 tested for that amount of money as well. So they are uncommon to have the abnormality, but now the cost makes it affordable, so more people are really interested in doing the testing.
Okay. And just on the topic of cost, are there any Medicare rebates involved?
Look, thanks for raising that point. From 1 November last year, 2017, a Medicare rebate did become available. In the affected women, depending on family history, they may meet eligibility. But also if you've got a known gene defect in the family. So if somebody presents to you and says, look, my sister or my cousin or my aunt has got this BRCA1 gene defect, that automatically means the person is eligible for testing. It does have to be done by a specialist, and it can be sometimes tricky to track down the causative mutation, and that's what genetic specialists do. But it is important to point out just anybody with a BRCA1 in their abnormality or BRCA2 gene fault now can get Medicare funding for that test.
Okay. And Michael, what's involved in testing a patient with breast cancer for BRCA? Oh gosh, I can never get my head around it. BRCA1 or BRCA2. What's the process involved? Sorry for being a lay interpreter there.
You can see why the BRCA1, BRCA2 rolls off the tongue more easily.
Oh.
But so most instances it's still a blood sample, although the testing I'm doing involving panels of 30 genes is saliva-based sample. So that type of panel approach isn't yet widespread or common through the public system. They're mainly using blood samples. Traditional pathologists have always used to managing blood samples. But we're basically testing healthy cells, either in the blood, which are the white cells, or in your mouth, which are, again, mostly white cells. So the quality of the results are comparable whether you collected blood or saliva. We're testing the normal cells, not cancer cells, to look to whether there's a gene fault in any of them.
Okay. And does that simple testing process lend itself to being easier to engage people in regional areas in testing?
Oh, absolutely. And transport, for instance, some of these saliva samples we're sending to California, and you collect the saliva in a tube. I've had patients in Emerald. It took 5 days for the courier to get out there. It's usually just a DHL type courier. But the sample's very stable once it's in the preservative, and so it does help overcome some of those geographical problems, and also people have needle phobia for that matter. If you spit into a tube, most people don't have too much anxiety about that.
Okay. And so who are the types of patients that GPs could or should be looking out for who would be good candidates for genetic testing?
The Medicare rebate actually says they people have a 10% or better chance based on a quantitative algorithm. And that algorithm really looks at family history. So the family history components that go into it include age of diagnosis, type of breast cancer, so triple negative breast cancer in particular is associated with BRCA1 gene defect, whether that woman's had bilateral disease or multifocal disease is relevant, whether there's any family history of either other relatives of breast cancer, which count, or men with breast cancer, particularly family history of ovarian cancer is quite a strong risk factor for BRCA1 or BRCA2. Some unusual ones like Jewish ancestry, which is a risk factor for having BRCA1 or BRCA2. The more of those features that you can tick off, then the more likely they'll get Medicare rebate for the testing. But I do see quite a lot of people where for $400 they just like the extra peace of mind, and that can be done now without necessarily meeting the Medicare eligibility.
Okay, great. And there's two more questions I'll ask you, Michael. One about the mail order and online, and then about insurance. So we've seen, advertisements on Facebook and other places like that you can do your genetic testing online. What's the quality and calibre of that style of testing, and is it something that you'd recommend?
It's very hard for non-experts to assess, and even as an expert, I'm not in the lab and seeing how they're doing the testing. So it is important that the testing is done by an accredited, independently audited laboratory, and that's clinical testing. So I'd be very cautious about using results from a over-the-counter or a internet-only provider to guide your healthcare, because it's really too important to trust to somebody who you have no real confidence about the quality of the results. Having said that, if somebody comes along with a result that looks important, could be important, then I would refer them on, because we can confirm it. If there is an abnormality and it's real, we can confirm it, and that's not necessarily easy. That's not difficult or expensive to do that. So if a person does present with a result and it looks like it could be important, I would definitely refer them on for second opinion, and we usually would independently will verify if that result was of value or not.
And the typical time frame, Michael, I should have asked you earlier, and from start to finish of genetic testing?
The average now would be about 4 weeks, and if you need speedier testing, we can get it done more quickly than that. In the context of speedier testing, maybe it's going to make a decision about preventative mastectomy for a woman who's just been diagnosed with breast cancer. So for a woman who is considering mastectomy, and not all women want that, but if you've got a high-risk gene, it could be one of the pieces of information that determines you're more likely to go through a preventative mastectomy. But that's usually something your breast surgeon can arrange for you at that point, or refer you to get the testing if needed. But usually it's about 4 weeks from most people when it's not urgent.
Yes. And I understand from our conversations, insurance policies play quite a consideration in genetic testing. Would you like to explain that for the people listening?
Yes, existing policies aren't affected. So if you've already got some life insurance or income protection, or your children do, that policy won't be affected. Your medical insurance isn't affected at all. So you don't have to pay extra. We're not denied any medical insurance based on any gene testing for you and your family. When you take out a policy, they will ask about family history, at least as far as your first-degree relatives are concerned. So that's your parents. And if you had a parent has a gene defect, the BRCA2 gene defect, that piece of information puts you in a much higher risk category. So even if you've never even been tested, then you can either have a policy that's going to be knocked back or loaded, or they'll cap the payout, or they may put an exclusion on the policy. So ideally, look at getting your policy before you come and see the genetic specialist, I guess would be the message there. Or, but it does have to be a first-degree relative, is probably the most risk in that situation. If you test negative, of course, because it's 50-50, you may not have the gene defect, then you're quite happy to go back to the insurers and appeal the decision, and they will give you standard risk rate. But if you've tested positive or you've never been tested, they're still going to treat you as a high-risk person.
Okay. And Michael, thank you so much. Your insights and wisdom has been invaluable in this session and the other two videos as well. If some of the GPs or health practitioners who are listening have patients to refer, I know that you see people in Brisbane, but regionally as well, how can people get in contact with you?
Well, I have a website, brisbanegenetics.com.au. It's probably the easiest way to contact me directly. But I would say go to your nearest or local genetic specialist. So I'm not the only one who sees people privately. For example, most testing takes place through the public system, and the Medicare item number stipulates a specialist, but it can be an oncology or a gynecologist or breast surgeon. And increasingly, as they're becoming more comfortable and familiar, they're doing more of the testing through those channels, often quite appropriately. So in the first instance, try your nearest or friendliest clinical genetics service. Yeah, I can see people in regional Australia by video consultation and do that quite a lot, just really like we've done for this interview.
Brilliant. Thank you, Dr. Michael Gattis. We really appreciate your time and insights. Thanks again.
You're welcome, Megan. Thank you.